Hello and welcome. This VPAL signature event is brought to you by Harvard's Office of the Vice Provost for Advances in Learning in partnership with Harvard Online and the Harvard Alumni Association. I'm pleased to welcome our speaker this evening, Dr. Francesca Dominici. Without further ado, Dr. Dominici, the virtual floor is yours.
Thank you very much for inviting me and have this wonderful opportunity. And hi, everyone, and thank you for joining. My goal is to leave plenty of time for questions, so feel free to put it on the chat, and I really hope that this will initiate some interesting conversation and food for thought. So I'm sure I don't need to, remind everyone that we are living in a new world, a world of AI, and there are multiple opportunities as well as challenges with AI. In this talk, I will tell you about my experience and the ongoing research to basically try to understand the degree to which AI is really a solution to better advance a healthy adaptation to climate change, and particularly to exposure to air pollution and extreme weather event, or so is AI is going to improve environmental health, improve our ability to either cut greenhouse gases emission or reduce the adverse health impact of greenhouse gases emission and air pollution and extreme weather event, or AI is going to make our environment worse. And so we'll see if I will be able to tell you the answer one or the other. Let's see. Okay. So that's basically what we're going to talk about. And let's see how we're going to conclude this talk, if we'll have some sort of agreement or a disagreement. And I'm sure each of you, when I give this talk live, I always ask people to raise their hand in one way or another. And it's especially very interested how divided generally the audience are. So I'm going to tell you what are the trillion-dollar political questions that are happening right now in the United States, in the world. What is my journey? What do I do? Some of the most recent work that we're doing on AI for climate adaptation, and that is all of the bucket of doing research that you can use AI to accelerate our ability to combat climate change and to combat our ability of being more resilient to extreme weather event. And then I'm going to turn it around and I'm going to tell you the other part of research that I'm doing, where I'm going to talk about environmental impact in AI and how the explosion of these data centers and AI infrastructure can actually increase the exposure to air pollution and greenhouse gases. So what are some of the very high stake questions that are facing us, and there are now are extremely politically controversial and with very high stake, right? So one is whether the National Ambient Air Quality Standard for fine particulate matter, which is a pollutant in the air, is safe enough for our health, and whether or not they need to be lowered further. So we need to move with more stringent national ambient air quality standards in the United States, whether air pollution from coal-fired power plant is more toxic than other form of pollution. And so you know that it's very clear right now that there is a movement toward a deregulation in terms of ambient level of pollution of coal-fired power plants to be able to have a quicker energy actually to fall AI. And so these are the questions that I've been trying to address for a very long time. So back in 2024, I had the honor and privilege, after 20 years of work, to have to be able to directly influence a really important law, which were in 2024, the Biden administration decided to review and make more stringent the national ambient air quality standard for fine particulate matter. So that means that if before what was considered a safe level of pollution that you could breathe was 12 microgram per cubic meter, thanks to a large amount of evidence, and a lot of this evidence was produced by my lab, the Biden EPA decided to lower this national ambient air quality standard. And so instead of saying that the safe level was 12 microgram per cubic meter, the new safe level became 9 microgram per cubic meter. Now, what does this mean? What it means is that there is going to be additional regulation on power plants and cars, mostly. They are the two main sources of fine particulate matter, and clearly a huge gain in public health. And so we reported that lowering exposure to PM 2.5 would prevent 53,000 premature deaths. As this rule was extremely cost effective, by passing this law, it led to 608 billion in annual benefits from avoided PM 2.5 related illnesses. And then also you should know that there is a higher overlap between the key sources of PM 2.5, which is this contaminant in the air, and the source of greenhouse gases. So by passing a law that would require the state to reduce the ambient level of fine particulate matter, what that will lead automatically is in a very effective way of also reducing CO2 emission. And by the way, we have another study that we are working on it that actually shows that environmental law that try to limit the level of PM 2.5 in the air not only has the huge benefit that we are all breathing cleaner air and so we are healthier, but also is very effective into reducing CO2 emission, actually more effective than climate rules that try to target CO2 emission. So anyway, back in 2024, this was an extremely successful story for us and for public health and for the world. Now this is changing, right? So we have the new agenda is really very toward deregulation, including the EPA to start considering life-saving or setting rule in air pollution. And so that means that, regardless of which position you have in one way or another, I think this is more than ever really important to understand the science and how we can really make the right decision for human health. So the current political climate is that the Trump EPA has not yet repeal the PM 2.5 safety standard that was passed during the Biden administration, but has been taken a major step to weaken and potentially revise the Biden area of tightening these standards. And so my colleague at the Harvard Law Clinic, at the Harvard Law School, I'm sure they can tell you more about. But basically the point is trying to repeal, but not repealed yet. And so, as I mentioned, the 2024 Biden rule reduced the annual primary PM 2.5 from 12 to 9 microgram per cubic meter, but left the 24-hour standard 35. So my entire research, well, I should say a big chunk of my research has always been informing the government about whether or not safety level of 12 microgram per cubic meter were safe enough for human health that will justify changing this standard. And as I mentioned, the Clean Air Act benefit are there is a tremendous amount of stake from 1.9 to 3.8 trillion in 2020 and 2.5 trillion to 5 trillion in 2030. And again, that doesn't account the potential, but very well that can be quantified very well, the potential climate benefit. And so back in the past, this is again pre-AI, how did we influence that decision? And so the secret sauce of influencing a decision that was so important and so consequential is through rigorous science. And that's what scientists do. And so basically, to give you a sense of the path, is that we had the two landmark paper, one in the New England Journal of Medicine in April 2023, and one in Science in November 2023, providing an enormous amount of strong evidence about the fact that level of PM2.5, even below the national meteor quality standard, was still increasing mortality risk. And I'm going to tell you a little bit more about it. And also the fact that coal-fired power plants are actually more toxic. That PM2.5 from coal-fired power plants were more harmful. Also, I think that one thing that helped was on COP28, the opening address that happened in Dubai. At that time, Senator Kerry mentioned these two studies as basically saying that the climate crisis is a health crisis. And so that led, for myself and many other scientists to really this important decision, this Biden decision in 2024, which led to cleaner air, so lives saved, and less greenhouse gases. Now, what is behind all of this, right? And I'm not going to do a very technical talks, but to give you a sense is, and I'm going to explain to you a little bit more, what's behind all of the science is a massive amount of multimodal data from satellite images, data from electronic medical record, and I'm going to tell you a little bit more about that, a tremendous amount of machine learning, and then state-of-the-art approaches in causal inference. And by causal inference, what we mean is that the ability to extract from an enormous amount of data things that can tell you about a cause and effect. In this context, because we're thinking, to regulate a level of pollutant in the air, we needed to demonstrate that PM2.5 in the air is the cause of adverse health impact versus other things. So how we got there? Well, when we're also talking about artificial intelligence, whether is we start from the simple machine learning to the generative AI and now to the most multi-agent system, always remember that we need to start from data. These systems are as intelligent as the ability that you have to train them. And so if you train them with unreliable data or with messy data they can deal with, but with unreliable data, representative data, or small data, they don't give you the right answer. So what we started with was to gather data from the entire US healthcare system. So what does it mean? Well, if you are in the US, you know very well that there is no national care system. The closest approximation is Medicare and Medicaid claims, right? When you're turning 65, you enter into the Medicare system. And so we know as soon as you're 65, so if you are in the audience and you're 65-year-old, you are in my database. Don't worry, I cannot identify you, but you are in it. We know the zip code of residence. We know your age, gender, and race. We know that whether or not you are also eligible for Medicaid. And then we can follow you over time for every hospitalization. We know the date of hospitalization. We know the ICD-9 code for each hospitalization. And then for people that pass away, the date of that. This is for Medicare. So Medicare covers people 65 and older. And then we also have, although I'm not going to talk about Medicaid, and Medicaid covers all ages. And for people that are eligible to Medicaid, so that it tends to be of a lower socioeconomic status. And if you're familiar, Medicaid eligibility varies tremendously from state to state. And so remember that when we're thinking about using artificial intelligence model for policy decisions, data is everything. And we are actually not there yet. This is, one step is really to build the data platform that collects all information about our environmental exposures, levels of pollutant in the air, and we do that relying on satellite data, data that comes directly, emission that comes directly from power plants, data that capture extreme weather events from tropical cyclones to heat waves, etc., etc. Then we have another bucket where is the health outcomes, as I mentioned, that we have all of the information about the Medicare. And then we have what we call confounders. By confounders, we mean other factors that can confound the relationship between, say, exposure to air pollution and health. Because if we're saying that air pollution is the cause of an adverse health outcome, we need to rule out every other factors, right, that might correlate with air pollution and can be a cause as well. Classical example is poverty or lower socioeconomic status, right? So when we do this analysis, and again, without going too much into technical details, we need to compare level of pollution with health outcome among people, for example, they have the same socioeconomic status. So we can adjust for what we call it the confounder. So you immediately understand that the more data we have for more people and more variable now with this artificial intelligence system, better we can learn about the state of the world. And so there is a lot behind doing AI. And I think that's something that it's not talked about too much. In the same way, when you're using ChatGPT or Claude, right, what's behind, right, and this is why these companies are so rich, there is a tremendous amount of data and data harmonization. And now we're doing something similar, although not for ChatGPT, but for understanding what type of policy will be more effective for our health. And so, as I mentioned, a lot of data, a lot of harmonization, a lot of, I would say, unsexy work, but that is absolutely instrumental because you cannot build your own AI model to make policy decisions without having the foundation of the right data and the right data harmonization and the right computational infrastructure to be able to make decisions. So one analysis that we did, starting with some of the early models in machine learning, was basically, an analysis which was instrumental back in 2023, where we have a sample size of 623 million observation. Basically, we follow the entire US healthcare system linked to 1 kilometer level of exposure to air pollution, and then also do an analysis by higher income and low income and stratified by age, gender, and race to really understand whether or not the level of PM 2.5 that were considered safe was safe enough. And so this was basically the result that was instrumental in changing their role. And so if I can walk you through the plot on the right, basically what we did is we estimate something like the percentage of lives saved, right? The percentage of deaths avoided if the government will pass more stringent standard and will make the safety standard from 12 to 11, from 12 to 10, 12 to 9, and 12 to 8. And so at the end, they decided to go with 9. And so you see that more stringent are the safety level for pollution, larger is the reduction, right, in mortality, and larger is the reduction in mortality among the Americans that are lower socioeconomic status and they're Black. So the blue bar are the mortality benefit among Afro-American, and the dotted is for the white America with the lower socioeconomic status. And so basically, it was reported in the New York Times where cleaner hair helps everyone, and it helps Black community a lot. And then this was the work on causal inference and machine learning, where what we did is we look at every single coal-fired power plant in the United States active in the last 20 years. And so the map on the bottom, you see that each dot is a coal-fired power plant. Black, darker dots are coal-fired power plants that have more, they're dirtier with more emission. And then we look at the extra number of deaths associated with every single coal-fired power plants. What was behind this analysis, that is also where artificial intelligence and machine learning has a role, is the fact that we are not only looking at the exposure for people, exposure from the emission from coal-fired power plants for people that are nearby, but we also, through atmospheric chemistry models, and that's AI is really helping with that, we can trace how far the emission from one coal-fired power plant can travel to, right? And so basically the graph on top, it tells you, for example, that some of the coal-fired power plant each of them can have an extra 7,500 deaths just associated with the emission of that coal-fired power plants. So now you might wonder, okay, but what is AI, and what machine learning and what the AI brings to the table in all of this? And so I think what I talked about up to now were really impactful studies that use elements of I would say now all the AI. Some machine learning that allow you to assess causality, but not yet the full generative AI that we are now. And so let me start telling you at the higher level, what does it mean? So what does this AI now bring to the table to accelerate science and to accelerate this type of science in particular, right? Well, first of all, it'll solve the problem misaligned data. So what does it mean? When I say that we integrate data, we have a data that comes from satellite, there are 1 kilometer grid. Then we know the person where he lives, a zip code of residence. And so you have data that is measured at different spatial and temporal resolution. Before AI, we as a statistician know how to handle that, but there were a lot of assumptions. Now AI can automatically ingest and understand and learn about multi-scale in spatial and temporal. The other thing the AI can do that is extremely exciting is that when I show you, I always talk about exposure or pollution to risk of death. And then what we do is that we do a study of exposure of pollution and risk of cardiovascular disease. And basically what we do is we assume almost that every disease is independent from another disease, because we can joint model all of your health impact simultaneously, but it's hard. AI can do that. So that means that if when I'm looking at electronic medical record, I can simultaneously learn about all of your disease and how they can impact of each other. And so you can imagine that they make a much better inference, right? And so also learn models that can generalize across the geographic scale and new variables. So I can train the machine to learn about all of this data that I have, and then query the machine and ask, what should I do to prevent heat stroke, potentially in a community where I haven't had any data, and that can tell me about it, right? That's what is the generative AI. And so it can do automated data science, leveraging large language models and agents to scale up processing and estimation. So it is pretty cool. So what we're doing right now, we're using and building a foundation model, and is a generative equivalent of a generative AI model. This is a team Claudio Battiloro is a colleague, is in my lab, is a research associate and a computer scientist. And then we have James Kitch, which is a PhD student in the lab. We have data scientists, former colleagues. And what is a foundation model? And basically, we are creating this AI model that is called GEO because it needs to learn about spatial data to basically does geospatial reasoning with causality. It's basically learning all of that information to be able, with downstream tasks, to provide the policy decision and policy advice about how to become healthier and how to respond to extreme weather event and air pollution by analyzing all of the information together. Now, we have a competitor. So this paper was published by Google Research. It's publicly available. Also, it's interesting for you to see. So this paper is called The General Geospatial Inference with a Population Dynamics Foundation Model. It's a fantastic work. So also it's interesting the difference between now the industry and the academia, right? So this paper has 30 authors, right? And there is 5 of us here at Harvard, as well as all of the data. You can imagine that Google will not need to combine the information the way that we have, right? And so this is really fantastic work. However, one thing that this work is missing is that they don't have detailed data on the entire US healthcare system as we have. What they're doing, they're training the model on publicly available county level data, which you can imagine that when you're trying to make a decision about health, having more refined data, it's extremely important. As well as what, as a scientist, we are bringing physicians that understand what this different ICD-9 code means. But clearly, this is a fantastic work, and that's something that we are watching very closely. So what is a foundation model, you might wonder? So a foundation model is an AI model that is trained on broad data, generally uses supervision, contain at least tens of billions of parameters, and is applicable across a wide range of contexts. Developing a foundation model is hard. That's why Google has 30 people on it, right? And it's a gargantuan task for creating the database and testing and on and on. So what we're doing is we have quite a good amount of data. I've been working for 30 years on collecting this data. So I was ready for AI. I didn't know the AI was happening, but I was trying to be ready for it. So as I mentioned, we have 22 years of individual level hospitalization records, 22 years of exposure data, and 22 years. I mean, all of that amount of data. And so we have a data science team that made all of this data pre-processed and ready to be ingested for the AI. The other thing that people sometimes don't think about is that there is a difference between having an enormous amount of data and making this data ready for the AI model to learn, okay? That process, that mid-level process is really burdensome and extremely important. So this is a little bit of a technical slide, but you give a sense. It's like basically the ability to ingest data at different spatial resolution. And again, this is for the whole country. So to be able to learn about county level, zip code level, census block level, temporal data, and creating all of these data loaders. So this data loader, it's like, the little pre-prepared meals to basically feed to the AI. And so what is the potential? Well, when this is going to be done, hopefully soon, it really opened up to address all sides of questions that we didn't have been able to address before. And so we can understand what's the health impact of concomitant exposure to multiple extreme weather events, what to do about that, what type of early warning system in a localized fashion, right? Because you understand that an action for on preventing hospitalization, for example, from wildfire and extreme heat in a place in Los Angeles, California, will be different to what you will do in Canada or you will do in another part. And so why we are doing all of this? Well, because you have increased and transferable precision in these tools, okay? As I mentioned, we can leverage misaligned multi-resolution and multimodal data. As I mentioned, you can share information across multiple diseases on the same individual. And we are working on an ability for this model to start reasoning about cause and effect. Okay, so a lot of great things, right? And a lot of potential and opportunity for AI as an accelerator for science. And, I walk you through what a training a foundation model looks like in the context of public health or climate, but you can think about that it's not very different when you're thinking about training and building a foundation model for discovering new drugs, for discovering new materials, for astronomy, right? All of these elements, massive amount of data, multimodal data, learning, and basically fine-tuning for downstream tasks. So as you can see, I'm very excited about that. And I think the opportunity for AI as an accelerator to scientific discovery is huge. However, we also need to think about the other piece. Every time AI requires a lot of energy, a lot of electricity, right? And so what we are doing at the same time is on one hand, in the morning, we are excited building foundation model, but on the other hand, we also need to think about what this is doing to the society, what this explosion of AI is doing. So we're doing a research where we are very rigorously quantifying the environmental and the water impact, actually, and the electricity impact of this data center, or we call it the hyperscaler data center, which are data centers that are built to support running all of this computation for AI. And so I'm sure you have come across news where there are basically these gigantic, massive data center for all of the big tech. That can be Amazon, or OpenAI, or Anthropic, or Google and Microsoft. And they are really popping up as mushroom around the United States. We are the first that have done this really hard work. It's actually almost in investigative journalism, together with a lot of web scraping, to figure out where are these hyperscaler data center and where they're getting the electricity from. Okay, and so these are the ones that already exist. And then we're doing the same thing to understand the one they're planned. And how do you know that? Because you can again, this is about satellite information, because if you look at the hyperscaler data center, they have a very clear way that you can kind of distinguish using artificial intelligence model, by the way, to identify where they are, right? So what this map shows is there are the black dots. You don't see 403 black dots here because many of them are on top of each other. But the black dots are where the 403 hyperscaler data center are positioned. And I'm going to show you more data soon. And then the other colored dots are the type of power plants that are providing electricity to these data centers. So the immediate thing that you see is that most of these dots are either orange and red, right? Why? Because the great majority of the power plants that are providing electricity to data center are fossil fuel, are natural gas, coal. So that means more PM2.5, more pollution. A small minority is on renewable sources. So when you build the data, you can start addressing questions, and you can start be able to resonate. And so basically what we're doing as a first level is understanding the status quo. So what are the electricity consumption and sources and CO2 of these 403 data centers? What is the fuel mix of the power plant? Which states have the highest? And then we can start thinking about how can we be smart about it. I know that right now there is a race to build more and more data center. They're looking where electricity is more available, and often that comes from fossil fuel. So that is really from a scientific viewpoint, identify where the hyperscaler are, look how big they are, where they are, how much electricity they require, from which power plants, and what are the CO2 emissions. And so I just want to give you a sense. So this map shows both by the balancing authority, that is the unit where the electricity in the United States is balanced, and also by state, the CO2 emission that are directly attributable to the hyperscaler, this data center that have been built to support AI, right? So clearly, Virginia is a place where we have the largest number of hyperscaler, the largest number of CO2 emission, and as well as the largest amount of electricity demand. This figure is interesting because what basically does is it takes the different balancing authority. So the balancing authority is the geographical representation of the United States that you see on the left panel, right? So you can see that some of these geographical areas are more CO2 heavy than others. And so when you look at this plot, it tells you in different parts of the United States, the fuel mix that support the data center varies. So on average, for all the US, which is the first, we have that 19% of the fuel that goes to electricity for data center is 19%, 42% is natural gas, 32% is nuclear, and all of the rest is wind and etc., right? And you see, though, that the composition vary quite a lot across the United States. And so there are some of the balancing authority, they are much more heavily relying on coal. And remember, coal-fired power plants, more emission, more toxic pollution, right? And others are less. So just to give you a sense, and again, this is actually already old because these are data that ended in 2025. And so if you see any of this plot, there is an exponential increase. So the total CO2 emission from the hyperscaler data center in the United States is 5269 metrotons. So, like, how big it is. So, and again, this is I'm certain, a pretty large underestimate. And so it's basically 52 metroton is the annual CO2 emission of a major city of a stable or sizable portion of the U.S. aviation, right? Right now is 1.1% of the proportion of the U.S. carbon emission. It's increasing exponentially. There's been a 5 times increase since 2010. The other interesting analysis that we are doing, this is a very preliminary work, but I wanted to just give you a sense, is also looking at the water consumption. This is also really hard. Basically, understanding for each water basin in the United States, so where are these hyperscaler, where they're getting their water from, and then try to overlay area where there is a tremendous amount of water demand from data center, plus our areas that are already stressed by lack of water, right? And so basically, the green area and the blue area, these are the one where we have both an higher demand for water, plus there is a lot of fossil fuel in terms of providing electricity. And so again, thinking about the public health and the community, this is something that we need to keep in mind. So some of this work has been reported recently on the MIT Technological Review if you're interested, and hopefully we are publishing some of this work pretty soon. So, I mean, okay, so what is true? Well, I'm not going to be able to tell you yet. I mean, I think there is so much more work that we need to do. But it is interesting, and again, just as a data point, is the fact that when the EPA did the 2024 regulatory analysis, found that if we were going to pass more stringent rule on coal-fired power plant, we will save around 52 metric tons of CO2 emission, which is equivalent of the increase of the CO2 emission that we are experiencing now with AI. So all of this to say that as I think that there is a lot that causal reasoning AI can do in creating a sustainable future. You can see, again, the huge opportunity. But I think, and again, there is still a lot of work that we need to do to train AI to think about causality and policy decision. But it's also really important to think about the responsible role, right? How we use the responsibility. So how also do we pass policy decision and start to regulate the massive explosion of data center? So then AI, in one hand, is trying to inform us as we can regulate PM 2.5, but then on the other hand is completely unregulated at the point that is relying too heavily on fossil fuel combustion. So I'm going to stop here because I want to address any question you might have, and thank you so much for your attention. This question is asking, how do you see the relationship between human expertise and AI foundation models in climate adaptation research? Where does human judgment remain essential? So thank you for this question. Human judgment is essential. It's paramount. And I do think that's why I see, especially when I can't speak for other area of research, but in this context, when we are talking about climate adaptation, we are talking about health, we are talking about communities, we are talking about social sciences, we are talking about behavioral sciences, right? So I think that, and I'm seeing it in also, so you need to build this foundation model in a way that there is involvement of all of these areas of expertise. And that's what it's wonderful of being at Harvard, because you need to have all of this expertise at the table. Sometimes the model can tell you things that makes absolutely no sense or can hallucinate. And so I think that there is so much a machine can really understand the intersection of all of these sciences. Having said so, can generate hypotheses that you would have not have thought about it. Absolutely, right? Can really extract information from things that before. So what I'm seeing on this foundation model, so for example, when you're trying to overcome data, different spatial temporal resolution, they can be very smart in doing that. So I don't see AI foundation model replacing human judgment, but I see it definitely as an additional tool that will accelerate how we test hypotheses, and then also that will put in front of us things that we haven't thought about it. And I think that's extremely exciting. So one question is, could similar modeling approach like this one be applied to localized risks such as sea level rise in specific community? Absolutely. In fact, we are doing a wonderful project with Chris Golden. He's a faculty in the School of Public Health, and we are building similar foundation model for the entire country of Madagascar. And so there are other issues there. And so especially in terms of food security. Another interesting question is, what governance frameworks are emerging to regulate AI environmental impact while still enabling innovation and climate research based on new research? I would say there is not enough governance framework that have been built in the United States right now. I think that what's happening right now is, for good and bad, the AI excitement and the AI infiltration in all of the sciences is is happening at extremely fast and unregulated pace. And the environmental impact, not because I want to brag, but our work is the only rigorously scientific validated work that's starting to quantify using real data the environmental impact, right? So and right now I think in the United States we don't see a lot of incentive about that. I think in Europe is trying to start thinking about that. There is also a very fascinating area of research that I need to talk about, which is not something I work directly. It's called green AI, and so the ability to start developing code that is more computationally efficient. So governance frameworks are very much needed, but they are not there yet. And so I think that this is definitely an area where I think, first of all, Harvard can lead, but overall in the world, it's really, really important. So there is a question about nuclear fusion. So curious about what you think about the prospect of nuclear fusion, especially any variant that can retrofit existing fossil fuel or nuclear fission power facility. How do you think AI will affect this prospect? So I think that it's not my area. There is, I think, a lot of excitement of embedding AI into accelerating our discovery in the context of nuclear fusion. I don't think we are there yet to be able to overcome the energy demand that these data centers are requiring and requesting now. So I think what's going to happen 5 years from now, 10 years from now, it's hard to predict, but absolutely, I think that there is a lot of excitement of the potential on AI to find a way that can be that can allow to a more sustainable way of providing energy to AI. So this is an interesting question, and thank you for asking. It said AI is often wrong, biased, and unprofitable if it pays for the intellectual property ripped off to train, and comes with enormous burdens to clean water and air and local community. When is using this tool unwise? And so I think this is a very interesting question that goes back to regulatory framework, right? I think I agree, based on my own experience, is that right now the explosion of AI and the use of AI is basically comes at the expenses, of course, of the more vulnerable. And so I don't think we know yet whether, for example, the use of AI in delivering healthcare or in discovering new drugs will provide so much benefit that will offset what the local community are experiencing for the more polluted air and water. But one thing is for sure, what I would like to see, hopefully soon, is that some use of AI should be more supported than other use of AI, as well as, for example, we already start knowing that video generating is much more, has a larger electricity demand than the other tools. And so what I hope that we will converge is that video generating for entertainment purposes, for fake videos, for all type of things that honestly don't have a societal value should be regulated much more and having more stringent rules than use of AI for science to be able to detect cancer sooner or find the new drugs. But again, right now we are completely in at the early stage where there is really, first of all, there is very little work on understanding the carbon and air pollution and water footprint of the different use of AI, and then to be able to start regulating. I do think that AI is or now pervasive, and I think in some of the AI tools that you are using, from ChatGPT and Claude, actually some of them start documenting the carbon footprint of their prompt. And so I think that the use of this technology doesn't come for free, and we have to be vigilant. If negative impacts, at least for greenhouse gases, can be attributable to a facility, a company, wouldn't have this profound implication for a company economic risk and fiduciary legal challenges on excess debts? Yes, that's correct. So I think when we did a study on the coal-fired power plants, fortunately, most of the coal-fired power plants, they had the highest number of debts attributable. They have already been shut down. But this will be an argument for not delaying the shutting off of coal-fired power plants. For this hyperscaler study, we are not going to publish information on individual hyperscaler. And so if you notice that what we're doing is that we are only publishing maps on aggregated level. So I've been told to stop here, but there are so many interesting questions, and so I'm so glad you asked so many, because at least I hope that I got you interested in something, that picked your attention and you are interested in learning more. Thank you.
Thank you, Dr. Dominici, and thank you all for joining us this evening. We hope you'll join us for more events in the future. Information on upcoming events as well as recordings of past ones can be found at vpal.harvard.edu/vpal-events. More information about Harvard Online courses can be found at harvardonline.harvard.edu. Thank you and good night.